Welcome to the weekly dose of self-care, where you learn a medical condition in 5 minutes. So today, we're going to learn about how to manage dry eyes and how to choose eye drops in 5 minutes. When someone has dry eyes, they usually complain about a sandy or a scratchy feeling. They also complain about being tired, and the vision is a bit blurred, and usually the symptoms get worse throughout the day. In terms of when to see the doctor, is when you have dry skin, dry mouth, or it's caused by medication, or the worsening of your symptoms, such as there's yellow stuff coming out of your eyes now. The best thing to do for dry eyes is to blink more, because the more you blink, the more tears your eyes will make naturally. The next thing is that you want to make high quality tears, which is the balance between the water and lipid inside a tear. In terms of which part you are missing, you can speak with the eye doctor for a proper diagnosis. The next thing is that the tear glands is the one that produces the tears. To make sure it works more properly, you can use warm compresses to massage it. You can buy one of these green things and you can put it in a microwave until it feels warm and put it onto your eye until it feels no longer warm. I will go through these options one by one to let you know which eye drop you should choose in the end. The things we're looking for in artificial tears is whether they contain preservative, how frequent you plan on using the eye drops, when they expire, if it's running or not running, and whether we are trying to restore the water or lipid layer. The most ideal eye drop is the one that is preservative free and it's not runny. So basically it means when you put the eye drop into your eye, does the water come out right away or it stays in the eye. Next thing, it has a long expiry. The best way to know if an eye drop has preservative is to look for the ingredients to see if it contains benzalkonium, purite, or sodium perborate. So basically the best eye drop is again the preservative free one, and if you have other ones, I will advise caution. Now I'm going to go through each eye drop and let you know which scenario is the best to use which one. The first one we're going to talk about is the Systane Ultra preservative free, because these ones are the single use ampules. This is the best for occasional use, such as you use one drop every 3 months. The reason for that is each box contains multiple single-use ampules, so unless you open them, they're good until the expiry date on the box. But if you do open them, you gotta throw it away in 1 day, and this ampule is preservative-free, which is a good thing. The ones listed here are best for frequent users of eye drops, because all these products are preservative-free, and they have a long expiry at least 6 months after opening. Now for the middle and the left eye drop, they're the easiest to use because they're a pump. So each pump you press is 1 drop of tears. But for Hydrosense, you gotta squeeze the bottle, so sometimes it might be harder for those who have hand issues. If you wake up with dry eyes, then I recommend seeing the doctor, just because it might mean that you're not closing your eyes properly when you sleep. Now, if you've seen the doctor and he's okay with it, then you apply this eye ointment in the eye before you go to sleep. The last one we're going to talk about is if you don't want to see the doctor, or you don't know if your tears is missing water or lipid, then you can just use Systane Balance, because it has both components in one eye drop. Here is a highlight summary slide of the things we talked about. The thing I did want to mention is that I added a column about whether these eye drops are okay to use with contact lenses. After you choose the right eye drop for yourself, you also need to know how to use the eye drops properly. Before handling the eye drops, make sure you wash your hands. Then you tilt the head back and look up. Then with one of your fingers, pull down on your lower eyelid to form a pocket. Then you squeeze the eye drop into the pocket. Then close your eyes for at least 1 minute. The other thing to do is to press your fingers lightly on your tear duct. So basically a tear duct is the side of your eye that is closest to your nose, just as shown in the picture. Some people may wonder, am I using too much artificial tears? Yes and no. It all depends on which tear drop you're using. If it is the one that has preservative, then it's recommended to use maximum 4 times per day. But if it's preservative free, you can use as many times as you need throughout the day. If you're using more than 10 drops per day, I recommend seeing a doctor, just to find out what is causing the dry eyes and also try to limit long-term use. After all, you want things to be as natural as possible. If you like what you're hearing, remember to subscribe and like, and I'll see you next Saturday at 8 p.m. Bye!